Dr. Eshwar from India. The topic is expanding the horizons of spine endoscopy.
Very good afternoon to all. Myself, Dr. Ishwar. I am from coastal town of India, Visakhapatnam. Already all the pioneers have discussed most of the things about endoscopy. I am just telling you the some different cases in the endoscopy. So all these indications were already dealt by all the pioneers who have already discussed, like listhesis, cervical disc, lumbar canal stenosis, migrated disc. So I will discuss beyond the degenerative pathology, like one is discal cyst, another is vertebral body metastasis. Here is the first case. 29, a young male who is a heavy machinery operator. He has right leg pain for the last 3 months. Examination shows SLRT positive, but there are no focal neurological deficits. So this is his MRI showing a cystic lesion at alpha S1 disc level, and apparently it has a connection with the disc here. There was a history of trauma, mild trauma 1 month back, 3 months back. So here are the treatment options I discussed with the patient. One is microscopic laminar foraminectomy and excision of the cyst. Another is endoscopic excision of the cyst, CT guided puncture, and root block. All these things were already tried and they were already documented in the literature. So here is the small operative video. After laminectomy and flavectomy, this is the epidural fat I am removing. And after that, there you can see a semi-translucent cyst stretching the root and the theca. The wall of the cyst is having capillaries. So I am dissecting the cyst from the theca, dura. It has no connection with the dura or root. So it's not the synovial cyst. Once I punctured the cyst, there is old clots came out of the cyst. So these are the old clots from the cystic wall. After that, I excised the cyst and I did the annuloplasty, and patient is relieved of his pain. Here is the just another theca and the cyst, and after decompression, the root is medialized here. So histopath confirms the same, the discal cyst, and patient returned to his work after 2 weeks. Here is the second case. She is a 62 years old lady with a severe back pain and bilateral radiculopathy. There are no motor deficits. MRI shows multiple vertebral body lesions, and at the S1 body, it is compressing the caudal roots. And patient is having severe radiculopathy. She is unable to walk. So I discussed all the options, but she refused for the, she refused for definitive procedures like iliac fusion and other things. So I offered her endoscopic decompression and biopsy. So these are the extent of the dissection and biopsy, where you can see the extent of the dissection from vertebral body end plate to the mid part of the vertebral body. And here is the small video taking the biopsy. Sorry for the poor quality of the video. That is the root, and I am taking the biopsy from the root after root is free. So histopath So, squamous cell carcinoma. She is relieved of their symptoms, and she was sent for the oncology center for further management. So, here I am suggesting that apart from the degenerative pathology, spine endoscopy also helps in the palliative care of the spinal mets, other tumors also. So that is all. Thank you for giving me this opportunity.
Thank you so much.
And here are my special thanks to Dr. Dilip, who is my mentor in India, and his guru, Dr. Lim. And thank you.
Thank you. Nice presentation. Now, dear delegate.